I'm about to show you something that could save your legs. And I need you to listen very carefully because what I'm going to share with you today, most doctors will never mention. Not because it doesn't work, but because it's so simple, so inexpensive, that it doesn't fit into the modern medical system. But the research is there. The science is clear. And by the end of this video, you're going to understand why thousands of people are using this one kitchen ingredient to improve their circulation, reduce leg pain, and avoid the nightmare of amputation. Stay with me because this could change everything. Let me ask you something personal. When you take your socks off at night, are your feet ice cold? Do they feel numb, like they don't even belong to you? When you walk to your mailbox or around the grocery store, do your legs cramp so badly that you have to stop and wait for the pain to pass? If you're nodding your head right now, I need you to keep watching because what I'm about to share is specifically for you. My name is Dr. Benjamin Walker, but you can call me Ben. I've been practicing medicine for nearly 2 decades, and I've seen hundreds of patients suffer with poor circulation, cold feet, and leg pain. I've watched people lose their ability to walk, lose their independence, and in the worst cases, lose their legs entirely. And here's what breaks my heart. Most of them had no idea that simple, natural interventions could have helped them. Nobody told them. Their doctors put them on medications, scheduled procedures, but never mentioned the foundational things that actually improve circulation at the cellular level. Today, I'm going to tell you about one of those things. Something so simple you probably have it in your spice cabinet right now. But before I do, I need to tell you about Robert, because Robert's story is probably your story, and what happened to him could happen to you. Robert was 72 years old when he first came to see me. He'd been a construction worker his whole life, strong, independent, never asked anyone for help. But 2 years earlier, something changed. Robert started noticing that his feet were always cold. At first, he thought it was just the weather, just getting older, but it didn't go away. Even in the middle of summer, even wearing 2 pairs of socks, his feet felt frozen. Then came the numbness. Robert would wake up in the morning and couldn't feel his toes properly. He'd wiggle them and watch them move, but couldn't actually feel the sensation. It was like his feet belonged to someone else. That scared him, but he didn't tell anyone. He thought maybe it would just go away on its own. It didn't go away. It got worse. Robert started having pain when he walked. Not just a little discomfort, but severe cramping in his calves. He'd walk half a block and have to stop, gripping his legs, waiting for the muscle spasms to ease. His wife would watch him from the porch, concerned, asking if he was okay. He'd wave her off, tell her he was fine, just needed to catch his breath. But it wasn't his breath. It was his circulation. Over the next 6 months, the distance Robert could walk before the pain started got shorter and shorter. A half block became 100 feet. 100 feet became 50. Eventually, Robert couldn't walk from his front door to his truck without having to stop twice. A man who'd spent 50 years lifting heavy materials, building houses, working 12-hour days, couldn't walk 30 feet without severe pain. Robert finally went to his doctor. The doctor examined his feet, checked the pulses in his ankles, and said the words Robert had been dreading. Peripheral artery disease. Your arteries are blocked. The blood can't get to your legs properly. That's why your feet are cold. That's why you can't walk. The doctor started Robert on medications. Pills to thin his blood, pills to improve circulation, pills to manage the pain. Take these every day, the doctor said. They should help. Robert took them faithfully every single morning, every single night. After 3 months, there was barely any improvement. He could maybe walk a few extra feet before the cramping started, but he was still severely limited, still in pain, still getting worse. Robert's wife started doing all the grocery shopping because he couldn't walk through the store anymore. She'd come home with the bags and Robert would sit in his recliner, feeling useless, feeling like a burden. He'd spent his entire life taking care of his family, and now he couldn't even help carry groceries. But what really destroyed Robert wasn't the physical limitation. It was the fear. Robert's older brother had died from the same disease 10 years earlier. Robert had watched it happen. First the cold feet, then the pain, then the ulcers that wouldn't heal. Eventually, gangrene. They amputated his brother's leg below the knee, but the infection had already spread. His brother died 3 weeks after the surgery, never left the hospital. Robert was terrified. He was following the same path. Every night, he'd lie in bed unable to sleep, imagining his feet turning black, imagining the amputation, imagining dying in a hospital bed like his brother. His wife would wake up at 2 a.m. and find him in the bathroom, examining his feet, looking for any sign of discoloration, any cut that wasn't healing, any indication that the end was beginning. Robert stopped leaving the house entirely. His grandson's baseball games, his daughter's birthday dinners, church on Sundays, everything stopped. He couldn't walk from the parking lot to the entrance without severe pain. So he just stayed home, sitting in his recliner, watching TV, waiting to get worse. When Robert came to my office, he looked defeated. "Dr. Ben," he said, "I don't want to lose my leg like my brother did. But these medications aren't working. Is there anything else? Anything at all?" I looked at Robert's medical records. 2 years of treatment, multiple medications, regular checkups, everything documented. But one thing was missing. Nobody had asked Robert about his diet. Nobody had checked whether his body was getting the specific nutrients it needed to actually heal his blood vessels and improve circulation. His doctors had given him pills, but nobody had addressed the inflammation destroying his arteries from the inside. But I'm not going to tell you yet what I recommended for Robert, because first, you need to understand what's really happening inside your arteries when circulation fails. You need to understand that blocked arteries are only part of the problem. The bigger issue is inflammation. Chronic, ongoing inflammation that damages your blood vessels and prevents them from working properly. And that inflammation can be reduced with specific natural compounds that most doctors never discuss. Comment below right now if you have cold feet, leg pain when you walk, or if you've been diagnosed with circulation problems. Type yes so I can see how many of you are dealing with this right now. Now let me explain what's actually happening inside your body. Your arteries aren't just pipes that blood flows through. They're living tissue. The inside surface of every artery is lined with a thin layer of cells called the endothelium. These cells are incredibly important because they produce a molecule called nitric oxide. Nitric oxide keeps your blood vessels relaxed and open, allowing blood to flow freely. When these endothelial cells get damaged or inflamed, they stop producing enough nitric oxide. When that happens, your arteries become stiff. They can't relax and dilate the way they're supposed to. Blood flow decreases dramatically, even if the arteries aren't completely blocked. You end up with cold feet, numbness, and pain when you walk, not just because of blockages, but because your blood vessels have lost the ability to function properly. What causes this damage to the endothelium? Inflammation. Chronic, low-grade inflammation that's happening inside your artery walls right now. This inflammation is triggered by oxidized cholesterol, high blood sugar, stress, poor diet, all the things that are part of modern life. This inflammation damages the delicate cells lining your arteries. It prevents them from producing nitric oxide. It makes your vessels stiff and narrow, and it creates a vicious cycle. More inflammation leads to worse blood vessel function, which leads to more inflammation. The medications Robert was taking were trying to force blood through damaged, inflamed, stiff arteries. But they weren't addressing the inflammation itself. They weren't helping his blood vessels heal and regain the ability to relax and dilate. They were managing symptoms, not fixing the root cause. And here's what most people never hear. There are specific natural compounds that directly reduce inflammation in blood vessels, that help damaged endothelial cells recover, that increase nitric oxide production and improve blood flow measurably. These compounds have been studied in clinical research. The mechanisms are well understood. The results are documented. But most doctors never mention them. Are you starting to feel frustrated? You should be. Because this information exists. The research exists. But people like Robert suffer for years without anyone telling them about these options. Now, before I reveal what this compound is, I want you to do something. Hit the subscribe button right now. I know I haven't told you what it is yet, but subscribing helps this channel reach more people who are suffering with circulation problems. More people who need to hear this information. Please subscribe right now. The compound I'm talking about is found in cinnamon. Specifically, Ceylon cinnamon. Not the cheap cassia cinnamon you find in most grocery stores, but true Ceylon cinnamon. This type of cinnamon contains powerful compounds that do multiple things for your circulation. First, it's a potent anti-inflammatory. It reduces the chronic inflammation in your artery walls that's making them stiff and preventing proper blood flow. The active compounds in Ceylon cinnamon have been shown to lower inflammatory markers measurably in clinical studies. Second, it helps protect your endothelial cells from damage. It shields them from oxidative stress, allowing them to function properly and produce the nitric oxide your blood vessels need to stay relaxed and open. Third, Ceylon cinnamon improves insulin sensitivity and helps regulate blood sugar. High blood sugar damages blood vessels directly. By helping keep blood sugar stable, cinnamon protects your arteries from this damage. Fourth, it has natural blood-thinning properties. Not as strong as medications, but enough to improve blood flow and reduce the risk of clots forming in narrowed arteries. And fifth, cinnamon helps reduce LDL cholesterol oxidation. Remember, it's not cholesterol itself that causes problems. It's oxidized cholesterol that triggers inflammation. Cinnamon's antioxidants prevent this oxidation from happening. Research has measured these effects directly. Studies show that people who take Ceylon cinnamon regularly have better blood vessel function, improved blood flow, reduced inflammation, and better circulation markers across the board. Some studies show measurable improvements within just 4 to 6 weeks. When Robert came to my office desperate for answers, I started him on a simple protocol. Every single morning, he would take 1 teaspoon of high-quality Ceylon cinnamon powder, mix it with warm water, and drink it on an empty stomach. The key is consistency. Every morning, without fail. Why Ceylon cinnamon specifically? Because cassia cinnamon, the common type sold in most stores, contains high levels of a compound called coumarin. In large amounts over time, coumarin can damage your liver. Ceylon cinnamon has very low coumarin content, making it safe to use daily for extended periods. Robert started this protocol alongside his medications. I didn't tell him to stop his prescriptions. I told him to add this natural intervention and see what happened. Within 3 weeks, Robert noticed something. His feet didn't feel quite as cold in the mornings. It was subtle, but it was there. By week 5, the difference was unmistakable. His feet were warmer, not completely normal, but warmer than they'd been in over 2 years. The numbness started improving around week 6. Robert could feel his toes again. When he walked, he could feel his feet hitting the ground instead of just seeing them move. That sensation alone brought tears to his eyes because he'd forgotten what it felt like to actually feel his own feet. The cramping pain in his calves started improving at about week 8. Robert tested it carefully. He walked to the end of his driveway, waiting for the pain to start. It didn't come as quickly. He made it to the mailbox, then to the neighbor's house. By week 10, Robert could walk an entire block without having to stop. 1 full block. He stood there on the sidewalk with tears running down his face because for the first time in 2 years, he had hoped that he might actually get better. After 4 months, we ran new circulation tests. The results showed measurable improvement in blood flow to Robert's legs. The blockages were still there on imaging. They hadn't disappeared, but the blood vessels were functioning better. They were more relaxed, more dilated, allowing more blood to flow through even the partially blocked areas. Robert's doctor was surprised. He'd never seen this kind of improvement in a patient on medications alone. Robert told him about the cinnamon. His doctor was skeptical at first, but he couldn't argue with the test results. The numbers don't lie. At 6 months, Robert could walk half a mile before any discomfort. At 9 months, he could walk over a mile. He started going to his grandson's baseball games again. He'd walk from the parking lot to the bleachers, sit down, and watch the whole game. His grandson would wave at him from the field, and Robert would wave back, crying behind his sunglasses because he'd thought he'd never see this again. Robert's wife told me that he'd started sleeping through the night. No more getting up at 2 a.m. to check his feet. No more lying awake terrified of amputation. He was sleeping peacefully for the first time in years because he wasn't afraid anymore. He was getting better, and he knew it. At 1 year, Robert's feet were warm to the touch. The numbness was completely gone. He could walk as far as he wanted without pain. The disease hadn't disappeared. The arterial blockages were still visible on scans, but his circulation had improved so dramatically that it didn't matter anymore. His blood vessels had healed enough to compensate. He was living a normal life again, all from 1 teaspoon of Ceylon cinnamon every single morning. Now let me give you the exact protocol that I gave Robert. First, you need to buy real Ceylon cinnamon. Don't just grab any cinnamon from the grocery store. Most store-brand cinnamon is cassia, not Ceylon. You want to look specifically for Ceylon cinnamon powder. You can find it online or in health food stores. It's usually labeled clearly as Ceylon or true cinnamon. Every morning, before you eat anything, take 1 teaspoon of Ceylon cinnamon powder. Mix it with 8 ounces of warm water. You can add a small amount of honey if the taste is too bitter, but keep it minimal. Stir thoroughly and drink the entire glass. Do this every single morning without exception. Consistency is absolutely critical. The benefits build over time. This isn't a quick fix. This is a daily practice that supports your circulation and helps your blood vessels heal. You can also add 2 other supplements to enhance the effect. Vitamin K2, take 200 micrograms daily. K2 helps prevent calcium from depositing in your arteries and making them stiff. It keeps calcium in your bones where it belongs and out of your blood vessels where it causes problems. Magnesium glycinate, take 400 milligrams daily. Magnesium helps your blood vessels relax and dilate. Most people are deficient in magnesium, and this deficiency contributes to stiff, constricted blood vessels. Now, important safety information. If you're taking blood-thinning medications like warfarin, Plavix, or aspirin, talk to your doctor before starting cinnamon. Cinnamon has natural blood-thinning properties, and combining it with medications requires medical supervision to avoid excessive bleeding risk. If you have upcoming surgery scheduled, stop taking cinnamon at least 2 weeks before the procedure and tell your surgeon you've been using it. If you have liver disease, talk to your doctor before starting, even though Ceylon cinnamon is safe for most people. Everything I'm sharing is for educational purposes. This is not medical advice. Do not stop your prescribed medications without talking to your doctor. Use cinnamon alongside your medical treatment, not instead of it. Work with your physician, monitor your symptoms, and if things improve, your doctor can adjust your medications as appropriate. Share this video with your loved ones who are facing similar health problems. Send it to anyone you know struggling with cold feet, leg pain, or poor circulation. Your share could genuinely change someone's life. Tonight, I want you to think about Robert. 2 years of suffering, unable to walk, terrified of losing his leg like his brother did, medications that barely helped. Then he started drinking Ceylon cinnamon water every morning. Within months, measurable improvement. Within a year, living normally again. Walking, sleeping, enjoying his grandchildren, living without fear. That could be you. Starting tomorrow morning, 1 teaspoon of Ceylon cinnamon in warm water. It's that simple. It's that accessible. And it could make all the difference between losing your mobility and keeping it, between cold, numb feet and warm, functional ones, between watching your circulation deteriorate and watching it heal. Subscribe to this channel for more health information that actually helps. Most importantly, start tomorrow. Give your body what it needs to heal and watch what happens. I'll see you in the next video.